Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. Sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today, we will be talking with Rita, who practices in South Carolina. Rita is a family nurse practitioner who is currently working in hospice and also does some aesthetics on the side as a 1099. Rita is needing assistance with choosing her niche practice idea and believes this is due to her rural location. She is interested in opening a men's health practice, but is suffering from analysis paralysis and personal limiting beliefs. Fear is getting the best of her, and she is needing the push to pull the trigger and to just get started. Hi, Rita. How are you?
I'm good. How are you?
I'm doing good. Hey, thanks for hopping on this phone call and doing this podcast with us. I really appreciate it.
Awesome. Can't wait.
Yeah, just bring us up to speed with where you're at in life. How long you've been a nurse practitioner for, what you've been doing as a nurse practitioner, just sum up where you are in life right now.
Sure. Well, I am coming up on my 5th year, so I'll be doing all those wonderful credits for recertification for 2022. But when I first graduated, I started in pain management, doing the medication management, working up interventional procedures. Well, I worked with an anesthesiologist at that time that I knew, had worked with for years in the OR. And I stayed there for about 3 years and ended up leaving because I wanted to get more into the aesthetics, which he sent me to a class. So that's what started it all. So I wanted to do more of that and work a little bit on weight loss, health promotion, disease prevention side of things, get out of the medication management side with chronic pain.
Sure.
And as a single mother and the only income and not having a good solid savings to dip into to be able to support that kind of dream, it just didn't work out. I tried doing a little bit on my own, worked a little bit at a methadone clinic and Suboxone clinic, which was great. And I love that. It just wasn't, enough hours to support that either, but ended up going full time with hospice. And I've been with them. I started PRing with them back in 2019, but full time in 2020. So just finished a year with hospice. Since doing that, my mind goes a million places, taking many courses of yours. I want to incorporate a little of all of them, the weight loss, the women's hormone, the men's hormone. Would love to be able to offer all of those things to a variety of clients and just to kind of help prevent obesity, fight type 2 diabetes as far as preventing, just different things that help promote health. But I've also thought, do I want to do psych? And do I want to go back for that? No, I tried a little bit of telepsych as a 1099 as well. And that's just not what I'm wanting to do either. So
Sure.
Yes, honing in on what I want to do is key, and my location is my concern.
Okay, so you've been doing a few different things as a nurse practitioner. So you're you've been around. You've been doing quite a few different things. Yeah, so you have lots of different experiences and those sorts of things. Which one appealed to you the most?
As far as
just everything you've done as a nurse practitioner. What's really appealed to you the most so far?
I'm not sure. Only because I feel like if something really appealed to me, I would have felt like that's what I wanted to stay in. Like if hospice really fulfilled me, which is great. I found out that I like hospice more than I realized when I tried to do the telepsych kind of on the side. And it's great, but you're stuck still at home. And now I'm used to kind of getting out, hitting the roads. So it's
Sure.
that I realized, okay, I like hospice over that. Pain management, I
Yep.
love the interventional side. So I love the education of patients and I love teaching them about things. I don't know if I would enjoy health coaching. I thought about doing some functional medicine type stuff. Haven't signed up for your course on that one yet, but I probably will. So just, I don't know. That's what I don't know. I need like a test that I take
Sure.
that just determines like, where I
Sure.
need to be. I'm in my early
So,
40s. So, I don't want to work like this forever. I would like some
yeah.
financial freedom and I would love some passive income of multiple kinds. So my interests are all over the place, even outside of medical.
Okay. So financially, you said you're a single mom. Do you have like a large emergency fund or anything like that? It sounds like you might not have a whole lot of money to work with here.
I did have a good fund until we had to replace the transmission in my son's truck. So, you face those, like I said, I'm the only
Yeah.
one that pays for any of that. And he is also with an alpha male clinic here that I'm not really happy with. I know the guy, he's my medical director for hospice and he owns his own place, but I'm just not really happy with the results that my son's getting. He's not getting that individualized treatment that you spoke of in the course and how everybody needs a little different treatment. And so that's motivated me, but that's a cost, that's a cost every time he needs medication refills. So, I have lots of expenses that I don't have help on.
So basically, you need to start something that's fairly affordable.
Right.
You need to continue to work to cover your living expenses and
Right.
just to cover your life in general, right?
Right.
Yeah.
Which is doable. It is doable. That's the best
Sure.
part about it.
So with the hospice, what are your hours looking like there? I mean, how much time do you have to spend a week doing that? And how much time do you think you could dedicate to, a side hustle?
5 weeks ago, I'd have told you I had 2 days a week to dedicate to it. It's just picked up recently with the few holidays and, I had a birthday, so short weeks and then the patients just kind of adding on now, but it's still very flexible. Like today, for example, I went to work, I got to the first patient's house, and mind you, I live about an hour and a half away from the counties that I work in. So I do cover Horry and Georgetown County, which is near the coast, and I live inland. But I got there at 12:30 for the first patient. I saw 4 patients and I was home by 4:00. So I had the morning hours and then I've got the afternoon hours. So it just really depends on how hard I work and if I stay focused when I'm out seeing patients
So could
that
you,
varies.
okay, so then if you're going to maintain your hospice position,
Mm-hmm.
can you dedicate a specific set of hours to a side practice during the week, like a Friday afternoon or a Wednesday afternoon or something? You could make that work.
Yes, like in my mind, when you mentioned it in the course about Monday mornings and Thursday evenings kind of are your injection rotation days. That would be so easy to do, just to have those off hours. And I think off hours are important. And also I wanted to ask if you can incorporate, like I go to people's homes now, and even with the aesthetics, that's a concierge service. That's no brick and mortar. I could also even lower my expense possibly. I loved your advertisement and marketing suggestions in the bars and the bathrooms at the golf courses and that kind of thing. So, considering marketing costs, and I do have some money set aside for 1 or 2 months worth of low marketing costs to begin with. So I do have some of that, but to keep overhead, I wondered about adding it as a concierge type service. That would be possible. No?
Sure, absolutely. I mean, there's no question you can do that. Yeah. But to determine what we're going to do in terms of what niche service you're going to pick, I mean, this ultimately depends on what your hours are. I mean, you can't operate an IV infusion clinic 5 days a week and only be there 2 hours, like you have to. Right. So, back to that question here, you have 4 to 8 hours during the week to spend on this while you continue to work to maintain your financial situation, right?
Yes.
And then this needs to be somewhat of a low expense practice at first until you start building up some money reserves too, right?
Yes.
Yeah. Okay. Like you don't have the kind of funds to open up some crazy $20,000 or $30,000 boutique aesthetics IV infusion wellness practice with fancy leather furniture and all that kind of stuff.
No, I do not.
Right. Okay. Gotcha. But you don't need to do that. I mean, my men's health practice was in a dump at first. I mean, it doesn't need to be fancy. Right.
Okay.
And so then you mentioned that your son was getting kind of poor treatment at this other men's health practice in your area. And so you're seeing this firsthand. And so does
Yeah.
the men's health component, does that strike you as something that you would like to do?
Yes, it does.
Okay. Well, no, that's good. I mean, I think that's a good starting point. I mean, men's health is pretty
Yeah.
simple, but if this other guy, like, is he in the same town? Or are you going to be jumping into this with competition right from the get go?
And I'm not saying they don't, they do a good job. He's been concerned and he's mentioned things that have maybe turned me off because it hurt my feelings a little bit. Like maybe he suggested my son was Kleinfelter. I'm not sure. So maybe I just have a personal turn off towards that. But yes, he is a few counties away. In other words, from where I live, in my rural location, he's on the coast. So it's not
Okay. So he's not a
direct,
competitor.
not really, not unless I set up at the coast, but
Right. Now, your area specifically, though, do you have
mhm.
any idea how many people are in your county?
I know how many is. I can look up the county real quick because I looked up the local. I just looked up the local little town.
How many people are in the
Around
town?
1,200.
1,200. It's a very small town.
Yes, and the one that's about 15 or 20 minutes away has 6,500.
Okay.
Two small towns.
And so the population of the county then would be probably 20,000 or so.
138,000 for the county.
Oh, goodness. That's plenty. You have more
Yeah.
than enough patients. Okay. Yeah. I mean, if you could get into an area of 80,000 plus people, you can pretty much start any practice that you want. Okay. Yeah. I mean, I know NPs who've started wellness practices in little podunk towns of, 5,000-6,000 people, and they're doing really, really well. My men's health practice is in a small city of about 100,000 and we're killing it.
Yeah.
So yeah, I mean, I know other NPs have started IV infusion centers in towns of, 5 to 10,000, and they are just doing amazingly well. So
Right.
if you have over 100,000 people in your county, then you have a very, very large market here. How long does it take to get anywhere in the county about? I mean, is it like a county that takes 2 hours to drive across, or is it a county that you can get anywhere, within 30 minutes?
I would say probably an hour to get from one end to the other. I think you could probably cover it in about from any direction in an hour.
Okay, so then if you were in the middle of the county, if you set up shop in the middle of the county, in theory, everyone should get there within 30 minutes, plus or minus 10 minutes or whatever.
Yeah, maybe 50. Maybe 50, the rural parts of the outlying county into,
Sure. Yeah. Yeah. Okay. I mean, people will drive 30, 45 minutes to come see you. I mean, they will. Okay.
Yeah.
And the good news is that, with telemedicine, you don't have to see these people in person every single time you see them now, as long as you see them one time in person, for the first visit, testosterone is a controlled substance, right?
Mm-hmm. Right.
I mean, technically you don't need to see them right now with all the restrictions, being lifted secondary to COVID. So, I mean, technically you don't even have to see them in person right now, but, setting up a model to where even if you saw them in person one time for the first visit, then, you should be okay even seeing these people via telemedicine after that. So that's how my men's health clinic's set up. We see the person typically one time in person, and after that, it's just telemedicine visits. So if you set up shop, in the middle of this county, then, I mean, you could pretty much open up anything you want. I mean, what's your competition like for wellness kind of stuff? HRT, weight loss, IV infusion, functional medicine, integrative medicine, these kinds of things. Is there anyone else doing this?
There's a few that I can think of. There's a weight loss clinic that I worked at a little bit, but she doesn't do hormone therapy. There's a weight loss. He's a family physician who's been doing weight loss, and he's got several locations across, the eastern part of the state, and covers, I don't know if he does hormone replacement therapy. I've looked before, and I want to say that the closest, I don't feel like there's one in the county. The problem is right in the middle of the county. You're right there around both of the large hospital systems. So you've got lots of residents, lots of family practices. There's a college, it's college town. But there's also several golf courses. There's, different.
Well, then that's where you need to set up shop.
Local gyms, that you spoke of, and getting in on and.
Yeah, that's where you need to set up shop then, is in that town. If it's pretty much in the middle of the county, it's a fairly decently sized city, then that's definitely where you need to set up for sure. Okay. So yeah, what you need to do, you just need to do a little homework here and see if there's any men's health clinics in that city or in the county in general. Is there anyone doing IV infusion services? See if there's anyone doing this. There's people already doing weight loss, so let's not go down that path. Okay. You don't want to start a business in a saturated market. Don't just cause more competition for it. Try to be different, deliver the need. right?
And it's also
So
something that you could probably treat your patients with selectively, and not advertise necessarily, but if you had patients that came in, then,
sure, you can treat
hey,
them with weight. You can do whatever you
yeah,
want. Right.
right.
Right. So then, you mentioned earlier that you want to develop some sort of passive income stream here too. So I'm really thinking here that maybe, Men's Health and IV infusion would probably be your better bets here because, with IV infusion, you could have RNs or LPNs, doing the IVs and seeing patients and doing that stuff while you're not even there. You just sign a standing order. Men's Health,
Oh,
if you
yeah.
follow the model in the course, it should develop a partially passive income stream for you. So I think that maybe doing those two things would be a good starting point for you.
Well, let me ask you this. Do you think that men, like I know you spoke about the personal questions that you have to get into when you talk about sexual history, are men more hesitant to talk about that with the woman than they are with the man? Like, should I
Absolutely
look for
not.
male nurses?
No.
Okay, they don't care.
No, they
Okay.
don't care. They
All
just want
right.
treatment. Okay. I have two other nurse practitioners employed at my Men's Health practice, and one's a female, but the patients don't care. They could care
Okay.
less. And I think
All
that
right.
other nurse practitioners listening to this would probably agree, that treat men, they don't care. They just want treatment. So don't let that limiting belief, get in your way. If there is not a Men's Health clinic in your town or in that county, you're sitting on a potential gold mine here. Okay. I mean, you really are. I mean, it's a great little side practice. It
Yeah.
really is.
I mean,
So,
and I like helping people. Who doesn't, right? I mean, that's
right,
what we're here
sure.
for.
Yeah. Yeah. I
Yeah.
mean, you're making money and you're helping people. I mean, it's a win-win situation here. Yeah.
Yeah.
I think that you might just need to do a little bit of market research here. If there's no one doing it, I would jump all over the Men's Health.
So
If
by
there's no,
market research, and these are other questions real quick while you say these words that kind of, I don't know marketing, I don't know business. And I think that's where I run into some of the paralysis as well, because I think I
yep.
overthink it and
Okay.
I just freeze. And so when you say stuff like market research, how do you do that?
So it's
Just
really
Google
easy.
it,
So
Google search.
pretty much. I mean, in today's day and age of, just the internet and search engines and stuff, like you do not need to hire a marketing agency to do market research for you. That's a total waste of money. Just get on
Right.
Google, type in Men's Health practice, click search and see what comes up. Use different keywords. Maybe instead of just Men's Health practice, put testosterone clinic, testosterone practice, Men's Health and testosterone clinic, testosterone doctor near me, just things like that. See what
Okay.
comes up. If nothing comes up, then it's pretty safe to say that you really don't have much competition.
Okay.
And if there's other providers in the area doing it, but they're not advertising on their website, then I wouldn't even consider them really competition, because you're going to be the one that's going to create a strong internet presence here so that when people do search for Men's Health or testosterone, you're popping up.
Yeah.
And you build that internet presence by having a Google business listing and a good website. If you do those two things and call it a Men's Health testosterone clinic, patients will just come to you and you won't even have to really even advertise it.
Okay. Gotcha. Yeah. Google business listing and good website. Okay.
Absolutely. All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all Elite Nurse Practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and the other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode.
Any other questions to guide me?
So if you are, if you want to develop multiple passive income streams, so the true path to wealth and the true path to financial independence, okay, for really anybody, but for nurse practitioners specifically, is to develop a passive income stream, not just one, but develop multiple passive income streams here. And so if you're in a county that's lacking services, then you could build multiple passive income streams here. So let's say that you start with the men's health practice at first. So let's say you do this 6 to 12 months from now, you're doing really, really good. You're generating $10,000 or $20,000 a month in revenue. The trajectory of your life is changing. And so what can happen is that after a year or so, after you gain that business confidence, that only comes with experience. Okay. No one can teach you how to be confident in business. Nobody can. No NBA can do that. Nobody can. You just have to do it. So after a year or so of getting your feet wet, you can start that IV infusion clinic. If there's no one else in town doing it or no one in the county doing it, start that. Now you have another passive income stream. Right. So now you have two passive income streams, building wealth, bringing you money in on a weekly basis. I mean, you have to put a little bit of work into it to see the patient, sign orders, those sorts of things. But overall, though, it's a partially passive income stream. It's great. So, thinking long term here, you could build multiple passive income streams here, and it would really change the trajectory of your life. I mean, you're in your early 40s here. I mean, you could retire in 10 or 15 years if you do it correctly. If you invest the money correctly. Yeah, it's just getting this first project started. Once you get that first project up and running, the second one's easier. The third one's even easier. The fourth one's a piece of cake. The fifth one, you don't even have to try.
Well, it's like you said, you built that business confidence by the end. And so then you're like, okay, I got this.
I feel like I could start a new practice right now in a matter of a week with a blindfold on. It's really not that hard once you do it a few times.
Yeah.
So I think that your analysis paralysis and this fear that you're experiencing to, just get started. I think that the only way you're going to break through that is to just start. And then after a year, it should get better and better and better for you.
Well, see, I started the little aesthetics / wellness that I thought I was going to be able to do out of the weight loss clinic. And it was kind of going to be a business thing that we did. I rented a little room out of there. But I guess my presence, I wasn't there because I wasn't really getting paid. There wasn't enough coming in for me. I wasn't really marketing. And so I feel like I kind of failed on the first go round a little bit because I had the financial backing at that point and I just kind of blew it and it didn't pan out and I ended up losing a little bit. But so I kind of feel like I've a failure under my belt. So I know what not to do, but some of the things that jarred my memory when you said market research, and then I was trying to think about what else it was earlier. When you say like special licenses that you need, just find out if you need certain, it was in the course. Business licenses, controlled substance. I think maybe was it something to do with the medications? Oh, I can't remember what it was now, and I'm scared if I go back to my notes,
You mean a controlled substance dispensing license?
It was something you mentioned in the men's health course about the certain licenses to kind of check in your area to see if you need one, because some don't. You don't with some because it's not Medicaid or Medicare and it's cash based.
Yeah, typically all you're going to need is, a legal entity, an LLC, basically.
Already correct. Just change the name and roll with it, or?
Correct. I mean, if you already have an LLC, just use that. I mean, save yourself the money.
How do you do an LLC as a DBA? So could I do that?
Yeah, you literally just put DBA after the LLC, and you can just. But
advertising, you could drop the other part of it though, and just use what you're using as a DBA. Is that right? I just wonder what would be the easiest way. Less than $200 to change the name, so it doesn't really matter. If I change it, that's not really.
So first off, what's the LLC's name?
Viva Life and Wellness. It's very broad.
Yeah, that's going to need to be changed to something men's health testosterone clinic or something. Yeah. How much does it cost to change it? You said?
I think it's like $125. I think.
Honestly, I would just pay the $125 and just change it. Just change the name. I wouldn't fool around with doing a bunch of DBAs and stuff. And I would just change the name and just be done with it. It's $125. I mean, big deal. That's what I would advise you to do. So you have the LLC, change the name. All you need is a local business license. Okay. That's it. So just a local business license. And then in terms of, South Carolina specific things that you need, I mean, I'm not an expert in South Carolina. So, if you're going to dispense controlled substances out of your practice, a lot of states require a controlled substance license to do that, or a license from the Board of Pharmacy. So you might need that. But if you're not going to dispense controlled substances, then don't worry about it. I would advise not dispensing controlled substances.
I was going to say, what would I need to dispense them for? I mean, would I need to?
No, it's a pain in the ass. Don't bother with it.
Okay. I don't think I would.
That's really about it. There's not really a whole lot you need here.
Okay.
But like I said, it's state specific. Some states do require some other things, but
Okay.
in most states, you don't need to get an inspection with the Department of Health. You don't need any of this stuff done. You're not accepting insurance. So,
Exactly.
CMS, Medicare, Medicaid regulations, all that stuff doesn't apply to you. That's the
Yay.
beautiful thing about cash. You can just start.
Yay.
Yeah, it's beautiful. This first little business that you started that failed, let's
Mhm.
talk about that. I mean, why do you think it failed?
Well, I had to get back to work. I couldn't give it the time. I had my mother who, I'm her only one. And so she just doesn't want to see me living off a credit card. And so she wants me to have that security. And I just didn't have it. So I guess I got a little nervous. And when the opportunity to take the full time job came up, I took it. And then it just took me away from it. I let my malpractice insurance, end, or I didn't renew it. And it just, I just had to regroup, I guess. I don't know that it failed. I just had to regroup.
Sure. Well, I mean, lesson learned, right? Don't let a fear stop you from doing something like that. But
Yeah, I think
that's
I realized
okay.
aesthetics as well. I think I realized to the extent of somebody wanting fillers in their face to like you're not working with a plastic surgeon or a dermatologist as your supervising physician. So then I just kind of like, I don't really want to work with that kind of clientele necessarily, you know.
Okay. Don't let it get to you, whatever. I mean, the first thing I ever started failed too. So it's just part of it. The road to success is paved with failures. Okay. I mean, it just is. I mean, you have to fail to succeed. You just do.
Yeah.
So that's not a big deal. No, I think that if you could just get started with the men's health clinic at first and do that, I think you'll be fine. I mean, just follow the structure in the course. It's all laid out for you there. I think that if you have some money to throw into this, you're not going to need that much. So let me ask you, how much money do you have to spend on this? Or let me reword that. How much money are you willing to lose on starting a business? Because you never know if a business is going to succeed or not. You just don't.
Right.
So
Well,
how much money are you willing to
so
lose?
so with this I'm sorry, 1099 journey that I just started with the aesthetics, that was a little bit of an investment, but they spoke of the return of investment is usually pretty quick on that. So I'm hoping to get that money back. And I'm hoping that that 1099 job will maybe help me build my business account back up. So right now I probably have in my business account roughly 3,000.
Okay.
But in a few months, when taxes come around, I'm not afraid to take some of that money that I worked hard for and paid in already to put towards something either. I'm just not. So if I have to do that, I have to do that.
So do you feel like that in 3 or 4 months time, you could potentially have anywhere between $5,000 to $10,000 in that account?
Yes, I
Okay.
do.
That's all you need. That's all you
Yeah.
need. I would
Mm.
set a hard number for this account. I think that you need to set specific goals. You strike me as
Okay.
someone who might kind of be all over the place. So,
I am. I think I got
okay.
ADHD.
That's fine. That's fine. A lot of us do. Okay. So you're going to
Okay.
have to really, really focus here. Okay. You're going to need to set yourself specific goals. And once the goal is reached, you then proceed to the next one. So I think step number one here for you is that you need to set a hard money goal. So once that account hits $7,500, it's go time. Okay. That's all you're going to need to get this started. You don't need that much. I think I started my first men's health clinic for like $5,000, maybe even less than that. It did not cost much to start. So $7,500, a hard number. When you hit that, you go. Okay. The next step after that, go find a place. Go find a place in that town that is somewhat affordable and then sign the lease. Get it done. Once you sign that lease, you are locked in. That's one of the hardest things to do when starting a business, because when you sign that lease, you're pretty much locked into that lease for a year. You can't really get out of it. And if you do,
Right.
they're going to report you to collections, and they'll ruin your credit and all that kind of stuff. Right. So
Exactly.
once you sign that lease, it's a lock in. You're committed. So
Right.
once you're committed, you really don't have a choice. And then after that, you need to set specific goals, furnish the clinic. After that's done, beginning your marketing campaign. Once that's done, work on your EMR and so forth and so forth and so forth. Just set specific goals and just create a
Okay.
list and hit each one. Once you hit one, you finish one, you go on to the next one. The last goal is basically seeing your first patient, really.
Okay.
So,
Do you think now, I know with some of your memberships, you kind of help people stay accountable for the specific goal. Is that kind of what you help them do? Is that worth something that I need to check into based off of your conversation with me and how I?
Yeah, the mentorship coaching kind of thing that I do.
Right. Yeah.
Yeah, I try to hold people accountable for, meeting specific goals and that sort of stuff. But I mean, I also just help them just through the process of it all. Like I'm someone there, over the first 3 or 4 months of opening their practice, just to be there to help guide them, help answer them questions, give them my advice and those sorts of things. So yes, I mean, that is something that I offer. For you in particular, I'm not too sure if that would be beneficial quite yet. I think that you need to hit that income goal of $7,500 first and foremost. And that's just going to be just through hustling.
Okay. I mean, it gives me and that helps.
So do you have any other questions there? I mean, I think that, it basically sounds like you have a great opportunity here and that I think you should totally take advantage of it.
Gotcha. I think so too. Yeah. And I think gotta, like you said, make these lists and check them off. And at least I got the first one here, and that helps. So
absolutely, let's just start there.
So I'm not worried about that at all. So I'm gonna start looking for a place soon.
Yeah,
hopefully.
Yeah, absolutely.
About that, yeah.
Yeah, cool. Well, do you have any other questions at all?
I don't think so. I think you covered pretty much what I was hoping to be able to, get my head in the right direction and kind of confirm some of the things that, no, you covered it. Yeah.
Cool. So why don't we do this? Why don't we talk again in like 4 or 5 months, see where you're at? I think everyone listening to this would love to know. Why don't we do like a follow-up, call in 4 or 5 months, and then, talk about maybe some more specifics and that sort of stuff. I think everyone would really, really appreciate that. I know I certainly would.
Okay. That sounds great.
Awesome. All right. Well, hey, Rita, thank you very much for this. I really appreciate, you taking the time to hop on this call, and I'm sure everyone listening really appreciates it too.
And I appreciate it as well.
Awesome. All right. Thank you very much.
All right. Thanks.
I hope everyone enjoyed the conversation with Rita. I think one of the big take-home messages here is that you need to look around your area. Don't try to reinvent the wheel. If the wheel's already there, then go with it, right? So she doesn't need to reinvent weight loss clinics in her area. There's multiple weight loss clinics already. There's multiple primary care offices, those sorts of things. But what there isn't is a men's health practice. So deliver the need, all right? I guarantee there is a demand in her county for men's health and testosterone replacement services. If there isn't an IV infusion center in her county, I guarantee you there is a need for that. So deliver the need. Don't go into this doing what everyone else is doing. You will have an uphill battle with competition. So it's very, very important that you think outside the box and you deliver what is needed in your area. If you do that, you will succeed because you'll be the only person doing it. If there are 20 aesthetics Botox clinics in your area, don't start another Botox clinic. That's stupid. So deliver what is needed. Deliver what isn't there. So I think that's one of the biggest take-home messages with this. And also, do not let limiting beliefs, do not let fears, and do not let others tell you that you shouldn't be doing this. Do not let naysayers tell you otherwise. Her mother was looking out for her best interests. I understand that. But sometimes the advice from your mother should not be taken absolutely literally, okay? So do not let other people control your destiny, all right? Do not let naysayers do that. If you have a good idea and you are confident, then you go with it and do it. I hope everyone enjoyed this episode. I'll talk to everyone later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2022 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.